Hi everyone. In today's clip, I will talk a little bit about ear issues. Just a reminder that anything I post here is not meant to diagnose or treat anything and is for information use only. For any health-related matters, please consult your healthcare provider. Ear problems can include a wide range of conditions affecting different parts of the ear, from the outer ear to the inner ear, and can cause a variety of symptoms. Here's a breakdown of common sort of ear problems and their potential causes or typical symptoms. We have earwax buildup. Earwax is naturally produced to protect the ear. However, sometimes it can sort of accumulate and harden, especially if pushed deeper by incorrect use of cotton swabs or even earplugs, or if the ear doesn't clean itself efficiently. Symptoms of this usually are muffled hearing, feeling of fullness in the ear, earache, tinnitus or tinnitus, ringing in the ear basically, and dizziness. When the earwax is liquid, then hardens, this could potentially be related to a situation where the wax is very soft or mixed with some fluid, perhaps from sort of irritation or a very mild infection before solidifying. We have different types of ear infection. There's middle ear infection, for example, but before I go on, so we call these two big flaps on each side of our head ears. So where's the middle ear? Middle ear refers to the medical terminology in which there are three parts to the ear. The external ear, the middle ear, which is the space bordered on the outer side by the eardrum, and the inside by inner ear. So the cause of this, as I was mentioning, is often viral or bacterial, which typically follows a cold or a flu. Fluids gets sort of trapped behind the eardrum, leading to inflammation. Symptoms would be earache, often throbbing, feeling of fullness, temporary hearing loss, fever, sometimes fluid draining from the ear if the eardrum is injured or ruptured. This drainage could be initially liquid and then dry and harden. Next type is swimmer's ears. And this is infection of the outer ear canal actually, often caused by water remaining in the ear after swimming, creating a moist environment for bacteria and fungi to grow. The symptoms of this could be pain that worsens when you sort of tug on the earlobe, itching, redness, and swelling of the ear canal, pus or fluid drainage. The next type of ear issue is ruptured eardrum. This can be due to a severe middle ear infection or pressure buildup, loud noise or acoustic trauma, they call it, sudden pressure changes or direct injury, like sticking a cotton swab too far into the ear, basically. The symptoms include sudden sharp ear pain, which may then subside, clear pus-filled or bloody drainage from the ear, hearing loss, tinnitus, dizziness. The drainage would sort of definitely start as liquid. The next type of ear issue is tinnitus. I have a separate clip on this topic alone, and if you're interested, you can view it. This is a perception of basically ringing or buzzing or roaring or clicking or hissing sounds in one or both ears where there's actually no external sound present. It can be caused by noise exposure, hearing loss, earwax blockage, Meniere's disease, certain medications, or underlying other medical conditions. Then the next type is Meniere's disease. This is a disorder of the inner ear caused by a buildup of fluid affecting balance and hearing. The symptoms include things like vertigo, which is the spinning sensation, fluctuating hearing loss, tinnitus, feeling of fullness in the affected ear. Next, we have Eustachian tube dysfunction, or ETD. This Eustachian tube connects the middle ear to the back of the throat and helps to equalize the pressure. If it becomes blocked, it could be from allergies, colds, sinus infections. Air can't get into or out of the middle ear properly. This will cause symptoms like feeling of fullness or pressure in the ear, muffled hearing, popping or clicking sounds, and sort of a little bit of mild pain. Next, we have there is outer ear issues like furuncle or boil, which is a painful pus-filled lump in the outer ear canal, and usually caused by staph infection or a hair follicle. Then we have dermatitis eczema. This is a skin condition that can affect the outer ear, causing itching, redness, flaking, and discomfort. Middle ear infections, being the most common, can be caused by various allergies that need to be pinpointed by elimination diet and strategy, and sort of, as well as sort of respiratory infections. In conventional medicine, the ear infections are treated through antibiotics, pain relievers, antihistamines, decongestants. In orthomolecular medicine, to address the deficiencies that might cause this, aside from various allergies that might be considered, it is advised to take, of course, high-dose vitamin C, as much as needed throughout the day until loose bowels present themselves. And then you drop down by 1,000 milligram and continue. Multivitamin and additional B complex, vitamin D3 up to 10,000 international units a day, zinc 10 milligram twice a day, magnesium chloride. Make sure it's not magnesium oxide. This is magnesium chloride, and selenium. Other helpful hints that can be sort of done are garlic ear oil. This is, for this, basically, you place freshly crushed garlic in black seed oil or mustard oil or non-toasted sesame oil or even olive oil. My preference is black seed oil. So you place this on a very low temperature. You want the oil not to come to a sizzle, but just stay warm until the garlic is infused for about an hour or more. Then you sieve it through a clean cloth or cheesecloth and do warm drops in the ear, lying down on one side and massaging the back and the front of the ear as you're doing this, basically. So you do this for a few minutes until it feels comfortable. Then you turn around to the other side and make sure that there's a towel on the pillow to absorb the oil that might come out, and do the other side as well. Then there's colloidal silver drops. Colloidal silver is a natural antibiotic, antiseptic, and antifungal. Putting colloidal silver in the ear will help kill any bacteria congregating in the ear canal, which can reduce the swelling and, of course, the pain. Then we have probiotics. Having an ear infection means you want to do all you can do to boost your immune system. One of the best ways to do this is with the help of pre and probiotics, which are available as supplements. I also, again, have a full clip on pre, pro, and postbiotics if you're interested to know more and for your reference. Also, as I mentioned before, try and get tested for food allergies. I have also a clip on the subject of vitamin C that you may benefit from, and you might want to sort of check that out if you wish. Metaphysically speaking, ear issues can be interpreted as a blockage in your ability to hear or receive information from others or from your higher self. It may be also associated with unresolved emotional issues or suppressed feelings that need to be addressed. But that's for you to sort of think about and find out what it was that you have suppressed or left unresolved, basically. Hope this has been helpful. Like and follow for more. Be the light.